there was a survey conducted by NCRT. I'm not sure if you are aware. It was a reported survey
Mm.
about, I think, last year or year before that, where, they run these hotlines through the year,
Okay.
for students to call in and ask their queries, get some doubts
Okay.
clarified,
Yeah,
talk about their issues and stuff like that. And they found that a
correct.
whopping 74% of students who called in were all worried about the kind of food they should eat.
Oh, that's really
Yeah,
surprising. Yeah,
really. So, and
yeah,
that was an eye opener for me. I said, if students are so interested in being healthy, then we should
yeah,
do something to help them do that, because they're not aware.
absolutely.
Not everybody
Yeah,
has access to a good nutritionist or a good doctor. And these are children from tier two, tier three cities, villages, wherever in India. India is a huge country. The tier one cities are a minority. So
yeah,
we include
correct.
that aspect also. And then we give them curated resources, online resources that they can use to help them overcome their behavioral challenges. And
Okay.
then we 10th, 11th, 12th, we work with students with, we work with students to give them career guidance. We identify their personality because parents want them to, just do engineering and medical. That's all parents
Yeah,
think about
yeah.
because it's their own dreams that they're pushing onto their children. The
Correct,
child
correct.
is not even interested in engineering, has no aptitude, doesn't want to
Yeah,
do it. Then you push them to do it. And what are quota suicides all about?
yeah, yeah,
Correct?
correct.
I mean, that's just one aspect of it. There are multiple
Yeah,
layers why a child might commit suicide. But
yeah,
forcing them to do something against their will, when their dreams, when their aptitude is somewhere else, is, I think, criminal of parents. So, but
yeah,
that's a different issue and a talk. So we help
yeah.
them do that. And then with undergrad students, we do a SWOT analysis. We tell them what are their enabler and inhibitor traits. What is it that they can use to strategize and go ahead in their career? Things like that. So that is for the
Okay.
students. For corporates, we work with them for recruitment to help them identify the person who will fit the job role that they have open for. So before
Okay.
they are, because everybody comes with very good interview skills, very polished resume. But within a month after
True.
they join, you know that, this person is just not good for my organization. What do I do?
Correct.
So we
Yeah.
help do something before, they hire.
So is it a set of tests again?
Yes, it's all in multiple choice question format. It's available in English, Kannada, and Hindi. And it takes about 15-18 minutes for a person to answer, and then they're done. And then we also work with organizations for employee development and growth,
Okay.
high
Okay.
potential identification, career progression, succession planning, a host of other activities.
Okay.
Yeah.
I think the way you're doing not just the tests, but especially with the students, where you follow up with how can it be corrected and what can
Yeah.
be done about the limitations they have, how can they work around it. I think that's the main thing, right? I mean, just
Yeah.
identifying it is one part of it, of course, which is very important. But
Correct.
then getting the right course and telling them what next, I think that's really amazing, Dr. Shilpa,
Thank you. In
because
fact, we
that is
identify.
as important.
Yeah, that's very true. In fact, we identify students who are facing undue levels of stress and we flag them to the authorities, the school
Yeah,
principal and the team,
correct.
the administrative staff. And then so many times in so many schools, the school staff, they don't even know that such and such a child is facing stress. you know
Yeah,
and once we flag
yeah,
them, they speak to the child, they speak to the parents, and then the counseling and all that starts, so they're able to help the child overcome, give them resources
correct.
to handle those, because it's a life skill, right? To handle stress,
Yeah,
everybody is
correct.
under stress.
Absolutely.
We need to know
Yeah,
how to handle it. So they give them those kind of techniques and all that, and that, I think, if we can save one suicide, I think our life is sorted,
yeah. True.
because
Very
hearing
true.
about it in the papers, reading is just horrifying.
Yeah. And also, like you said, when you see a child or a person, you hardly understand what's going within them. Like it's what you
Correct.
see. They show that they're perfectly normal, but then internally, I think that is what these tests bring out, right? Like what
Correct.
is it that they are
Absolutely.
facing internally? And
Yeah.
yeah, like you said, even if one life is saved, then it will
Saved
mean so much.
so much. Yeah. Real. That's true.
Absolutely.